According to the National Institute of Mental Health, nearly 19 million adults, or approximately 10% of the population, suffer from depression every year. Here you can see that males and females both suffer from pain with their depression. Not just the symptoms, but physical pain. Females obviously have more depression, or tell their doctors they're more depressed than men. Who can depression affect? Depression is not like any certain hair color, any certain eye color, whether you're rich, poor, famous. Depression can affect anyone. Many of us know Robin Williams. He is a victim of depression, and here I have a quote from Lizzie Dearden. She states, "Robin Williams' death has reminded the world that depression does not discriminate between the rich and famous and the rest of us, and is not something that people can simply snap out of." There are many types of depression, and as you can see here, the ones I have highlighted are the ones we're going to go over today. First, major depression. What is major depression? Major depression is a mental disorder that causes a persistent feeling of sadness or loss of interest. Depression, actually, they don't know what causes it, but they say it's more linked to heredity. Say your mother and father have depression, you're more likely to have it. Symptoms of major depression include lack of interest in one's enjoyable activities, loss or gain of weight, difficulty in concentrating or making decisions, changes in sleep patterns, whether it be insomnia or hypersomnia, and thoughts of suicide. Treatment for major depression include antidepressants, which is anything, and especially drugs, that can cure or prevent depression, or psychosocial therapy of various kinds. Psychosocial therapy is a therapy that has been developed to address interpersonal aspects related to possible problem situations. It is designed to help clients develop social skills needed in everyday life, whether it be talking to someone or helping their kids at home with homework. They just don't really want to do it anymore. Although doctors recommend antidepressants only work for 35 to 45% of people with depression. Therefore, doctors advise that you get not just antidepressants to help you, but also psychosocial therapy or various kinds of therapy. Now we're going to go over bipolar disorder. Bipolar disorder is characterized by severe or unusual changes in mood levels, interactions with others, energy levels, and the cause of bipolar disorder, kind of like major depression, is not entirely known yet. Here I have a quote from Dr. Stephen Berserter. He says, "A person who has one parent with bipolar disorder has a 15 to 25% chance of having the condition." Here I give an example. The ones with the check marks are people who do have depression. Here I have a mother and a father, the mother having depression because women are more likely to have depression than men. They have a daughter and a son. Obviously, the daughter got the depression. Women are more likely than men. The son goes and gets married to someone who does not have depression. The daughter marries someone who does not have depression. Well, even though the son and his wife do not have depression, 3 out of 4 of their children develop depression throughout their lifetime, while the daughter who did have it and the husband who did not, both of their children also develop depression. Symptoms of bipolar disorder include the urge not to go outside at all, a very poor attitude, living a very private life. They might lock themselves in their room just to try to avoid people outside, avoid public, avoid their family and friends. They will attempt to stay in bed as long as they can just so they don't have to deal with others in public. Thoughts of suicide. And as you can see throughout my PowerPoint, I show you that thoughts of suicide is in every single depression, from bipolar disorder, major depression, postpartum depression, persistent depression. They all include thoughts of suicide. Bipolar disorder is linked through a form of depression, which could be linked to deadly symptoms of bipolar disorder, meaning thoughts of suicide. How to treat bipolar disorder. Most doctors prescribe mood stabilizers. There's brand names, generic names, anything from Depakote, Gabatril, Topamax, and obviously your doctor's going to tell you how much you need of each one if you do need mood stabilizers. Standard antidepressants such as Prozac, Paxil, Zoloft have all recently been revealed to have serious risks and are linked to suicide, violence, psychosis, brain tumors, bleeding, and obviously your doctor will tell you if you do have past violence, past heart problems in the family, heart diseases, you're not going to want to take these. A more sensitive one that a lot of people don't like to talk about is substance-induced depression. Substance-induced depression is not depression before taking a drug. It is during a drug. You go to the doctor, they give you a drug. 2 weeks later, 3 weeks later, even a year later, you start to feel like, you haven't felt right in a couple of days. Then your doctor's obviously going to tell you you suffer from substance-induced depression. These depressions can be caused, this is a mental illness that occurs in a person using a particular drug. These drugs can be illegal or legal drugs. Anything from alcohol, Valium, heroin, and other narcotics, alcohol, anti-cancer drugs, steroids, and anything else. Symptoms include increased sleeping, fatigue, feelings of hopelessness, sadness or irritation, disengagement, and mainly thoughts of suicide. Obviously, doctors are not going to recommend antidepressants or mood stabilizers for someone suffering from substance-induced depression because it could further their depression. They will recommend electroconvulsive therapy, which is a therapy that sends passing of small electric currents through the brain to induce a brief seizure, changing the chemistry in the brain, helping further kind of simmer down what they're feeling, the thoughts of suicide or how they're feeling. And it's used when other things do not work. If your mood stabilizers don't work, your antidepressants, you're talking to someone else, if all of that does not work, then they'll probably go to electroconvulsive therapy, which does not hurt, and a lot of states use it today. Rehabilitation. Alcoholics Anonymous. Most people know what that is. I mean, there's plenty of teenagers who know what it is. There's adults. It's one of the world's most recognizable support groups for individuals suffering from alcohol addiction. National Institute on Drug Abuse is the national research leader on information provider on drug abuse and addiction in the United States. You can call them. There's hotlines. There's internet websites, just different things you can get a hold of them. Depression is one of the greatest problems and killers of our time. Everyone at some point in their life will be affected by depression, whether it be their own or somebody else's. 15% of people who are depressed will commit suicide. 15% of most developed countries suffer from severe depression. 30% of women are depressed, and 41% of the women who are depressed do not receive treatment and do not get help. 54% of people believe that depression is a personal weakness. Depression is not a personal weakness. It is actually a mental illness that anybody can get, from a 2-year-old at ECC, 3-year-old, all the way to a 98-year-old in the nursing home. If you do have any types of these depressions, get help immediately, whether you talk to your doctor or they'll tell you what you need, how you need to go about it. You can talk to a family member or a friend, and most people with depression actually push their friends and family away. They don't want anything to do with them, whether it be a mom talking to her kids, she just doesn't want to help them anymore, or a girl hanging out with her friends, she doesn't want to go shopping, she doesn't want to hang out. Guys playing video games, they don't want anything to do with them. And if you feel like none of those will help you, you can write in a journal. And I've heard it before that you don't have to keep it. All the papers you write, you can throw them away, you can tear them up, you can go back and read them and, go over and see, what will help me, how do I get help. And ending my speech, I hope that I have answered any questions that you have with depression, and if not, I will talk to you after class. Thank you.